Welcome to the Medical Report Podcast, where we bring health to your ears. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an adequate means to diagnose or treat you. We recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. Or if you'd like an assessment by one of us here on the panel, you can reach out through our social media pages. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your questions in the chat and we'll answer it in our Q&A segment later in the show. If you're watching this after our live show ends, feel free to ask your questions in the comments too. Also, be sure to like and share this video. We want to feel the love. Now, let's get on with the show. Hey y'all, welcome to the Medical Report, where we bring health to your ears. We are your hosts, Olu, Zinzele, and I am Anita. Today we have a special guest with us, triathlete, yoga instructor, and physical therapist, Mr. James Lambert.
Good morning, everyone, and good morning, guys. Anita, Zinzele.
Good morning. Thanks for joining us.
Thanks for having me.
We hope you all have been well. Olu, Zinzele, what you guys been up to lately?
Nothing.
No, Olu, you did your Spartan race last week.
Okay, so I did the Spartan race 2
so you
weeks
got first
ago.
place, right?
Yeah, I got first place. This is like the 5th year in a row. I'm just not thinking back.
Killing it.
It. You know how it's right.
Bring me the A game every time, right?
Congratulations, man. Yeah, that's amazing.
You don't see all these medals?
Wait, excuse me.
Exactly the same.
I got some over here. This one.
Exactly the same.
It's a PT thing then.
It is.
Type A personalities, right?
My PT is the same way. PT I work with, he's running triathlon. I'm like, really?
Yeah.
Right. So have you guys ever done physical therapy personally? And if so, what was your experience?
Anyone?
I had when I was in the military, I had torn ligaments in my shoulder. So I had to go for physical therapy for that. And then just general lower back issues, arthritis, bulging disc. I'm getting old.
You look good, girl.
I try.
Yeah. So, James, have you done physical therapy yourself, even as a physical therapist?
I have, for the first time actually in America, fairly recently, my knee, just some soft tissue stuff. And yeah, the experience was good. I won't say anything negative about my experience per se.
So basically you were like, no, you don't know what you're doing.
No, not at all. The only thing I would say is I would have appreciated and felt like I needed more time with that PT. And it seems to be the way the model works, is that you go to a PT, you're probably seeing for like 10 or 15 minutes, and then you're off with the PTA or the rehab aid for the rest of the time. And you just, as a PT, you kind of know that you need potentially probably a little bit more time with that PT.
Yes.
But you don't get that. And you're paying very good money for that service and et cetera, but it's not, I don't think people are getting the quality of care that they could and deserve to get, especially because you guys pay, or we pay, so much money for insurance, co-pays. And et cetera.
Yeah, my husband actually brought that point up because he's done physical therapy in the past, and he felt like his like exactly what you said. When he was doing it, he felt like it was very much like a check the box type of situation when he did his therapy at times. But he said he felt like it would have been better if he felt like he was able to take more tools away, I guess. I don't know if there's not enough. Maybe he didn't feel like there was enough education, or maybe he didn't know the questions to ask to help.
Well, a lot of times too, people will get a referral to PT and then they won't stick in there because of the copays.
Yeah.
Oh.
A lot of times, and they'll just take 1 or 2 sessions and go home. And they don't get the full experience. But like James was saying, you only get what, maybe 20 minutes, 30 minutes, and then that's it. You're done. I
So it's
think we
physical
all
therapy.
understand that part.
To go on your point, I've actually waived the copay for a few of the people that I've treated because I know that you can't afford 15, 20 sessions, which might be what you need. So, we can go a bit longer if you don't have that copay. But
Yeah.
I've had physical therapy on my knee. I tore my patellar tendon a few years ago, and it was a partial tear. So, I don't think we make great patients PTs, because I kind of thought that I would will it away, and then after a while, I was like, well, I can do physical therapy on myself, and I'll be fine.
Right.
But
Right.
you end up never actually doing it, and so it was weird I went to my friend's outpatient clinic, and he treated me, and I actually got a little bit better, but eventually I had to get the knee repaired. But I realized that we really make bad patients.
I feel like it's the same way in the nursing world. I feel like anybody in the medical profession is like, you're fine, you're not dying, so you're okay, right?
Right.
Yeah.
Yeah. And there's probably a little bit of the ego, like I know better than you, I know more than you, so I'm
That was another thing. Yeah.
maybe.
The PT who treated me had been, she wasn't fresh out of school, but like I had been a PT longer than her.
Yeah, you can
So
point
it
out
was
real
just,
quick when people don't know things. I'll go to a smaller study for my daughter, and I'm like, well, did you look over here? Did you?
yeah.
It's true.
Yeah.
Yeah.
Which, sorry, Anita. That's kind of leading on to the reason why I decided to go into my own practice and launch my own private practice, because we've all been in the healthcare system long enough and we know how it works. We know how functional it can be. Unfortunately, fraud is a very big thing. I know it's kind of like under the radar, but it happens. It's there. It's very prominent. And ultimately, the quality that we give people working within a big healthcare system just isn't what people need or deserve. So I was like, right, let's just do my own thing and offer people what I can offer and give them as much as I can offer them, and just give them time, because I think time is so valuable.
I agree.
So anyway, that was like a little caveat into
even in I feel the same way. Like even in my own experience doing telemedicine, I feel like a lot of the things that my patients really, their main thing that they love about the service is that I spend the time with them, the time that they talk to them about, educating them about what's going on and all this other stuff. And those are the things that a lot of times patients are really looking for. And sometimes the medical world can easily be translated into a money bank. And we forget to kind of add that, this patient is a person part into there, and it's important that we always focus on that, because that's really what it's about.
With James, with knowing you and not, you being aware of healing things available up to you outside of brick and mortar, what kind of prompted you to put yoga with physical therapy?
Good question. I'll try not to go on too much as to why.
Well, please do.
Yeah, it's fine.
This is what you're here for.
Yeah. So, to just go back in time a little bit, I graduated in England 2008, and that was kind of when I found yoga, and I took my first yoga class in Oxford, and I came out smiling, and I felt great. I felt amazing. I felt connected to my body. I felt grounded. I felt like a sense of peace. And I was like, wow, yoga. Apart from trying to find a girl and date someone at that particular time, because it was just full of girls, obviously, I thought, wow, this is a great experience. So I kind of took it up and I played with it over the years. Moved to the States. Anyway, to kind of come forwards, I was training for my first Ironman, 2018, kind of injured my calf, had to pull out of that Ironman at the time. And I was like, right, I want to keep active. I was like, oh, yoga. So I found the local studio in town and went there. took a couple of classes, and then the teacher was like, hey, there's a teacher training going on soon. So I was like, yep, I'm game. So I signed up for the teacher training. That was a 200-hour thing over 4, 5, 6 months or something. Became a certified yoga teacher, got my 200-hour. And again, just there was so much history, philosophy in the practice. Yeah, I just continued. I did another 300-hour training course, and then I started teaching yoga. So it's, I mean, I guess the answer to the question is really that Western healthcare can do so much, right?
Mm-hmm.
And then Eastern philosophies or Eastern practices, there's things that Western healthcare can't explain, and I can't necessarily explain, and I don't fully understand exactly what happens in yoga. I can give it my best educated guess, but the reason I kind of incorporated it is because I can see the benefits that yoga could bring to someone, as well as what I can do as a physical therapist. So I was like, all right, let's try and offer a merge of the two, and just see what I can do and help people the best I can. That's the fundamental reason why. Yeah.
What are some of the philosophies of yoga that you really enjoy, that since you've learned as a yoga instructor?
Comparison is the thief of joy is a big kind of philosophy, and it's a very nice way to go into a yoga studio, because I think some people have a lot of fear going into yoga, and they're like, oh, I can't do yoga, I don't know what I'm doing, I'm not flexible, I'm too old, I have no experience. And I think a really important thing is, to just allow people that safe space to come in and be like, look, you're not a 20-year-old female gymnast who can do ridiculous, unhealthy things with their body.
Yeah.
You can do some really safe movements. So I think, comparison is the thief of joy. But just breath. I mean, breath is a really important fundamental thing as well. And to be honest, that's what yoga was at the very beginning. It was all about meditation and breath work. And then the asana and the movement practice followed on from that, like hundreds and thousands of years, or not hundreds of thousands, but thousands of years later. Like essentially it was meditation and breath work. And you can do yoga just by breathing and meditating. You do not have to be a flexible athlete or whatever. So it's just education. Like I can help educate people to that.
Yeah, I've seen some Instagram videos of people doing breath work, like big deep breaths and that type of thing. And I was like, oh, I didn't know that was a yoga thing. But that makes sense. Yeah.
Pranayama, which is the Sanskrit word for breath work, which is where I took my name from, prana, which essentially is life force and energy. So you're breathing in life force and energy, which is prana, which is a really big word in yoga.
Yeah. That's cool.
I have a question. What does the majority of your clients look like? Are they grandmas? Are they athletes?
Great question. Quite a variation, mate, to be honest. I would say probably the larger population is, mature, sort of 40, 50, 60 plus. But then I have treated some younger, like 20 somethings, 30 somethings. So at the moment, it's quite a variation in terms of athletic abilities and activity. But it's interesting to see how a lot of people don't breathe well. And we do not, because we're all drinking coffee, we're all taking in caffeine. Our sympathetic nervous system is just elevated. We're all stressed, we're all busy. We've got all these goals, to-do lists, so that it really affects our breathing mechanics. And we're all apical breathers. And that just feeds into the stress, again, which isn't a good thing for the body. So just trying to educate people on how to breathe more effectively is something that I've seen people benefit from quite a great deal.
So are you teaching classes, or are you doing one-on-one treatments at this time?
One-on-one treatments generally. I haven't got back into teaching yoga classes at this point, but it's on the cards once I get things established in my business sort of set up a bit more. So I'd love to, yeah.
Zenzela and Olu, have you guys done yoga before?
Say that again.
Have you done any yoga?
Good question.
Very little for me. I guess I'm not flexible and I don't have the balance. But so
See?
I've actually taken a class on it. I took a CU course on it before, and yeah, I was like, I need to tighten some things up.
You're like, this pose ain't working for me.
Yeah,
I took a few
yeah. I mean,
yoga
I can do
classes.
downward dog, and
Oh,
You're like, that's about it.
that's about it.
So,
My
can
favorite
I-
is child's pose where you just lay there.
Yeah, good. As long as you're breathing, you're doing yoga.
Yeah, it's relaxing. It's calming.
No, but I actually incorporate, some of the yoga that I know, for some people who are just not flexible at all, who need something like that. So my 2 or 3 yoga poses actually get used. So that CU course was worth it.
Awesome. Zinzali, do you practice?
yeah, I do my mountain pose in the mornings for balance because I find with the geriatric population that I work with, balance is usually the biggest problem, and I don't want to lose it. So that's my starting point is mountain pose. But other than that, I've done it in classes, and it's relaxing and all of that. But that's it.
So personally, I feel like I did yoga. I did some yoga when I got pregnant with my second child.
I like hot yoga.
Because I got a lot of people telling me that, prenatal yoga is very good for preparing for childbirth and all of that stuff. So I was doing some yoga then. My son actually likes to do yoga. They teach him yoga in school.
Oh,
Yeah.
Wow.
The schools
Awesome.
now are implementing a lot of mental health care type exercises, and yoga is one of those things they actually teach in PE now.
Cool.
So he said his favorite pose is the tree pose.
Yes. Awesome.
And so he says that he really feels like whenever he gets upset that he likes to go off into his room and have quiet time and do a tree pose. And he said, yeah. I was like, oh, really?
That's so cool.
I was like, oh, we're that advanced now. I need that. I need that self-care. Hang on a second.
right.
But yeah, I thought it was very interesting. So I think it's awesome that they're teaching them those, different yoga poses and stuff like that to help them with like mental health and help them with learning how to move their bodies in different ways. So
Yeah.
pretty cool.
Can I ask you guys a question? Is there, like, in terms of what you just answered, like yoga and have you done it or not, but is there like any fear associated with yoga, or is it more a question of you don't feel the benefits or find the benefits at all?
I think for me, I guess for me, I wasn't really exposed to yoga very much. And when I thought about exercise, I thought about running or something like lifting weights or something like that, as far as like doing some type of strengthening exercises. But I know that yoga can help with strengthening and those types of things, but there's also other benefits to yoga that are not something that I was very exposed to. So I think that's really where the lack of use comes from for me, I think. Sometimes when I think about using yoga, I think about how much time it's going to take. But then I'm like, really, it couldn't be that. I mean, you could do shorter spurts of yoga, I'm sure.
Yeah.
But
I guess for me, I was at the gym and they had it at the gym. So usually they have it at gyms or a place where people work out or something. So for me, I needed that time for my workout. And so doing yoga would have added extra time on top of my workout. And I saw it as relaxation and a stress reliever and more of a self-care, but not a physical benefit. So
yeah,
since I didn't see it as a physical benefit, I saw stretching. Okay, great. I see
Yeah.
stretching, but I'm going to spend another half hour and do yoga. And it's basically saying we don't take the time for self-care. Is
yeah,
all it
it's
is.
exactly what it is.
Yeah, yes,
Said
it
it
doesn't have an immediate benefit like physical fitness.
Yeah,
I guess for me, I would say it's really two things. I wouldn't even know where to go to take a yoga class. That's number one.
Google.
And number two, yeah, Google, true, but I guess guys kind of look at it like it's a
Girl thing?
Yeah, a little
Hey,
bit.
that's true.
So I mean, I don't feel that way now. I would definitely do it, but probably back, when I was younger, I probably thought it was more of like a girl thing to do. And now I just wouldn't even know where to start with. How do I, like where do I go for a yoga class, especially now during COVID? Um,
Yeah.
I'm sure stuff is closed down. So
There might be
I
some
would,
online classes.
yeah, I mean,
Yeah.
I would probably just YouTube some stuff.
True. Might as
Yeah.
well. There's
I
plenty.
think if somebody had explained to me the physical benefits of yoga outside of relaxation, I'd probably be more apt to participate in it.
Mm.
Well,
So
I mean,
sorry, I have a question for James. So did they teach you any yoga in school, or did you learn all of this after? Because
I
they didn't
learned.
teach you anything about yoga in school here.
No, not at all, mate. Nothing at all. I mean, honestly, school, to be fair, was pretty poor in terms of education. I mean, physical therapy, yeah, it was basic, but you learned so much more on the job, right? Like, I guess most of us probably did. But no, nothing about yoga. I did all of it sort of, self-taught through trainings and stuff. Um, and that's the thing, though, it's not just about stretching. Some of those poses, like I come out of some classes and I'm sweating buckets because one of the main things is you're eccentrically loading the muscle. And that's kind of where the flexibility comes from, because you cannot actually lengthen a muscle. Like, it won't happen. What happens in yoga is you've got various levels of fascia and tissue and da, 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 da. And what happens in yoga is that you're active, the muscle's active. So it actually just allows the muscle to kind of be active, but just extend its contractility. So it's active. And then all these fascial layers of tissue will actually slip and slide. So you don't actually lengthen the muscle, you just increase how much slip and slide there is in all these layers of tissue between the fascia, the tendons, the ligaments. But it is a very good strengthening exercise, as well as balance, like you said, Sinzeli. And the breath work, because again, if you think about today, coffee, stress, and then you've got cortisol, blood pressure, heart rate elevation, all of these really negative things that our lifestyle brings onto us.
Right.
And with yoga, with breathing, and as I said, essentially that's what yoga is. Yes, there's movement in it, but unless you're breathing, the nervous system is not going to regulate. You're not going to get the vagal response happening. So if you do breathe, the heart rate's going to drop, your blood pressure is going to drop, your parasympathetic nervous system is going to kick in. And once that nervous system is relaxed enough, that is going to allow the muscle to do that slip and slide. So any kind of pain, or not any kind of pain, I won't say that yoga is going to solve your pain, but breathing with some movement will help change literally the physiology of your body. And help modify and regulate your pain response, because all these good things are happening.
Now, there are so many people, obviously, dozens and dozens of people who suffer from lower back pain. And there are meloxicam, all types of things out there available for people who are suffering from pain, even cannabis and everything like that. I often have thought that yoga might really be a benefit for lower back pain. There's sufferers.
Absolutely. It depends on the type of pain. And, Olu will sort of, appreciate that it could be like a disc problem.
Yeah.
It could be like a facet joint problem. So there are certain poses that will benefit the type of problem that they have. But then there are poses that could kind of increase that problem per se. So if someone has a disc issue and we're getting them doing lots of forward folds and flexion, we could increase that disc problem. But then if we do lots of extension work, the theory is that we could help that disc problem. So I think that's where doctors, for one, are very apprehensive with low back pain patients to send them and refer them to PT or yoga, because they automatically think that it's just stretching, and it's going to probably aggravate the disc. But if they do the right type of stretches in that yoga, it could actually help improve that disc problem and their back pain. But ultimately, Zanzeli, yeah, I think you're right. Like, it can help because it's regulation of that breath and that nervous system that will and can help reduce stress hormones and just change their pain response for the better. So it doesn't, yoga doesn't, as I said, it doesn't have to be like a crazy, ridiculous, flexible back bend or something. They can just sit and meditate, and that will change their physiology a little bit.
Do you find that it's, or have you worked with people who have had arthritis?
Yeah, absolutely. Yeah.
Guys, just so you guys know, we can start our Q&A segment. If you guys have questions, go ahead and leave them in the comments and we'll answer them as we're talking. James, I do have a question. Are there any other like non-traditional methods that you use at Prana?
Yeah, so coming onto the breath, actually, Anita, I've kind of in the last sort of 12 to 16 months learned that like the rib cage mobility can have a direct effect on how the core is active and how the pelvic floor, the core, because the diaphragm is part of the core stability muscles.
Mm-hmm.
So if the rib cage isn't moving and expanding, the diaphragm's not contracting and elevating, and then their pelvic floor and their core stability is not going to be active. So for me, assessing even shoulder pain or low back pain problems, like I look at the rib cage mobility. So that's not necessarily something I was taught, or it's not, I guess, traditional per se.
Yeah.
So just looking at that. Cupping as well. I use cupping, which is great because if you think about like massage or general hands-on treatment, it's all compressive because you're squashing, right? Which is good. Yeah. But then with cupping, you're creating a vacuum. And kind of coming back to what I said about like the slip and the slide of those tissues, if we create a vacuum, it allows space for those tissues to slide a little bit better.
So now you just need to become a massage therapist and yoga therapist, or you'd be all set.
My question. So, what type of yoga do you do? I just did a quick Google search. There's a lot of different types of yoga out there.
There is, mate. Very good question. I personally sort of vinyasa, but kind of with a hatha bias, which without going into philosophy, because there is a big philosophical sort of difference, but personally, I do like a vinyasa flow that's slow. So it allows people to come into a pose and breathe within that pose rather than doing like a hot flow vinyasa class where people are just like up, down, bend, because then it's like weightlifting or something. You lose the form and then it just becomes a workout rather than taking your mind from I've got to do this to within the body. Mm-hmm. And that's really key in yoga, is trying to come out of the mind and come into your body.
Yeah.
Because we all need that. So it's more like a vinyasa, but with a hatha slower paced. Yeah.
Like Olu, I did a little bit of research and I was looking at this lady who had done yoga and physical therapy, and she talked about anasis.
What's that?
I don't know. I don't know. But anyway.
What are you saying about it?
It was just saying that that's what she did in yoga, was something called ANASAS or something like that.
Oh, it's the asana.
Yeah.
Yeah, which is the movement. So what everyone generally knows of yoga in the West is the asana practice, which is Sanskrit for kind of movement, really. And that's all we do. Well, no, that's not what we do, but that's what yoga is the movement. But there's yama, there's the sutras, so it's learning like the philosophy and the mental, kind of like your ethical and your moral stance. So there's lots of different elements of yoga, not just the asana. Like going back to Patanjali's 8 limbs of yoga, there's all these elements, and asana is just one of those 8 limbs or paths of yoga, and it's the asana practice that is what we tend to do in the West. Sorry, you're challenging my thinking at 8:30 on a Saturday morning. I'm like, yeah, I've got to come back to my philosophy and history.
Yeah. Right.
Did you say earlier you did cupping too?
I do, mate. Yeah, not with a patient, but yeah, I do. Yeah.
Okay. I was gonna ask if you did anything else like dry needling as well.
Unfortunately, California being California, it's illegal to do dry needling. But I think there is a plan for, the APTA and the FSBPT and the California Physical Therapy Board to try and allow that to happen. I think because there's so many acupuncturists in the state of California that they kick up such a fuss. But yeah. Do you do dry needling?
Do I do it? No. I'm thinking about actually getting certification. It's
Yeah.
pricey though.
Do you have any
Very pricey.
non-traditional practices in PT, Olu?
Say that again.
Do you have anything non-traditional that you use in your practice?
Yeah.
No. No.
I'm like thinking about it. I'm thinking
Like
about it.
I do actually see mostly grandmas. So I kind of have to keep it a little simple.
Man.
We have a question that
Maybe
says, what is the difference between yoga and Pilates? Is one more beneficial than the other?
Ooh, good question. So Pilates is, I would argue that the focus on Pilates is to focus on the core musculature, and then the movements that they do always tends to come back on the core muscles. They have like reformer machines, and the movements are quite small, I would say. Generally,
They are.
Yeah, right. So
Yeah,
it's
I've done Pilates, and they have like these little tiny movements. I didn't like Pilates. It hurt.
Yeah. It's probably why you should do it more. No, I'm not saying
Yeah,
that.
right.
And yoga, I mean, there's the whole philosophy and the spiritual aspect, but I think with probably yoga, it's a little bit more movement based, and then the focus is probably more on the breath over the core per se. Is one more beneficial than the other? Yeah, I don't want to bias either way. I think they're both really, really beneficial in their own right, and I wouldn't bias either one. It depends what you're looking for. If you're looking for more of a spiritual practice, or are you just looking to strengthen your core and reduce pain, then I might steer you more towards a Pilates base. But I would honestly try both. And the thing I was actually going to say to my question to you guys earlier about like fear or something about yoga is it all depends, I think, on the teacher, because I've been to classes before with a teacher and I'm like, I'm not vibing with this person. I don't like their tone. I don't like their delivery. And then I've gone to other teachers and I'm like, wow, awesome. I love this person, their energy, their tone, their vibe. And it's it's like your doctors or your surgeons. You're like, oh, bad juju from this guy.
Yeah.
And it kind of comes back to that, I think.
It's like finding a therapist. I feel like finding a therapist is always very difficult initially because you really have to feel comfortable enough to open up with that person.
Absolutely. And yeah, so I would try a different yoga teacher and see what happens. But honestly, is it Lucius? Lucius is just try one or the other and see how it feels. Yeah.
How often does yoga need to be practiced for it to be effective?
Ooh, good question.
That's a good question.
Some yogis would argue every day. Just in like physiologically, just to maintain that like slip and slide of those tissues. But like general movement and exercise, I would probably say at least 3 to 4 times a week.
I could say my husband uses yoga every day because every single day he stretches in at least 2, 3, or 4 different poses. Not poses, just stretches.
Perfect. Yeah. And that's a great practice, like meditation every day, like journaling or yeah, that's a great practice. But yeah.
And when you have clients that you're using these yoga techniques, breathing techniques with, how often do you find, or I don't know if you're having much follow-up after they've left, that they're continuing to use yoga more frequently?
Sorry, I couldn't quite hear. There was a bit of feedback, I think, there. Sorry.
Oh, can you hear me now? Is it better?
I think
Go
so.
ahead, try again.
Okay. I was like, can you hear me now? Like,
Right.
so I was asking if, what is my question? I was asking if how frequent are patients that you're seeing, like when you're implementing these breathing techniques during your time with them, how often are they continuing to use yoga more frequently, I guess on a regular basis after care with you? Do you know?
I tend, it's a good question, actually. It depends what's going on. Like if it's a breathing pattern dysfunction or their rib cage isn't moving and then their pelvic floor and their core's not active, I would advise them to do some breathing techniques like every day. Because if they're habitually breathing up in their apices, their nervous system, their sympathetic nervous system is going to be up. So I would tend to try and steer them more towards a daily practice of just taking almost like a 5 or 10 minute meditative time out and focus on some deep abdominal breathing. And then if there's exercises with the breath work, then I would work on them every day with the client. But then if it's more like a movement based, depending on what we're trying to achieve, whether it's strength, mobility, it could be varying between every other day or every day, but it depends on the client, really. I hope that makes sense. Yeah.
Makes sense.
Speaking of which, so I was thinking, do you sometimes create your own poses? Like let's say you get an MS patient or a stroke patient, and they can't do the typical pose that everybody else would do. Do you modify things? And are there James Lambert poses out there?
Modification.
There will be after today, mate. I like that. Thank
Right.
Yeah.
The James Lambert pose.
Right.
That's brilliant, mate. I do. I mean, chair yoga is a very real thing in the world of yoga, and and it might be beneficial to some of your ladies in your practice, Olu, is you don't have to get on the floor. You don't have to be able to stand and balance on one leg. You can do some stuff just sitting in a chair. And even if you get them focusing on their breath, like inhale to lift and then exhale just to side flex. So you can do some chair stuff with movement, but with the emphasis on the breath work. Good question. It depends on the patient, and I do vary it, like either sitting, standing, lying. If they're a little bit more functional, then I do like more traditional stuff. And if they are a yogi specifically and they're looking for strengthening up in down dog or more range in down dog, then I'll do some hands-on manual treatment techniques, and then I'll bring them back into the pose and vice versa. So it depends on the patient, but yeah. James Lambert pose is coming up.
That's right. Heard it here first, folks.
Yes.
All right.
Well, thank you all for being with us today. Thank you, James, for coming on the show. We appreciate you.
Thank you very much. And lovely to talk to you guys and connect on a Saturday morning. Thank you, Anita, Zanzeli, and Olu. Cheers.
Of course. Everyone, we hope you'll tune in with us again in 2 weeks. Connect with us on our business and social media pages. If you're watching after our live session has ended, you can still leave your question in the comments and we'll get back to you. If you have suggestions on a healthcare topic you'd like us to cover, send us a DM. And we hope you stay well until next time. Bye.
Thanks, guys. Bye.
Bye.
Bye.